Well. Thank you very much for joining us again today. It's a pleasure to have you. We came your way last week, and this week you're going to have an amazing time um, learning a lot about how to stay fit in this COVID-19 pandemic. And we are so excited today that you could join us, and even more excited that Dr. Daniel Rajan will join us. Dr. Daniel Rajan will be our facilitator for today, and he's a consultant trauma and orthopedic surgeon in the Spire Cambridge Hospital in the UK. It's a pleasure, and he's also a fitness enthusiast. I have not met a surgeon who is busy and could still manage to have time to really be very fit. And he has been very fit. He does a lot of things that makes him fit. And there's no better person to take us through this webinar than him. And it's a pleasure to have had him, even amidst all his busy schedules, he could just make time for this webinar. So exciting. So thank you very much for joining us, Dr. Rajan. This is Prevent First Commission. And at Prevent First Commission, we are concerned about preventive health. We believe that the health system should be designed to keep people healthy rather than to wait for people to be sick. So we have measures of advocacy, things that we do to advocate for healthy living. And one of them is this series of webinars that is involved in helping people to live a healthy lives. So it's a pleasure that you responded to the call to help us get into this vision of helping to educate a lot of people who want to know how to live a very fit life, even in this pandemic situation that we are in right now. So it's a pleasure to have you, Dr. Rajan. You're welcome.
Okay.
Right. So audience, it's going to be in the form of presentation. Dr. Rajan will give us a short presentation, and after the presentation, you will have the opportunity to get in your questions. Now, he will be around to answer as many questions as possible that you could just bring on board. So you can just write your questions down. You can just send it via our comment section in our Facebook page, Prevent First Commission, or you can also send it at the comment section in our YouTube channel, Prevent First Commission. So he has the opportunity to answer that. So don't take your questions away. You'll be able to get the opportunity to get all the things that trouble you, how to do this, how to go about this, in fitness, how to go about this. He's versed into that. So just prepare and make your questions available. Then he will have the opportunity to answer them. So I can see that many people are joining in. Many people are joining in the live feed on our Facebook page, and we will continually invite others to also join in. So tell your colleague, anyone who is not here and will want to join in, tell everyone to just join in via our Facebook page, Prevent First Commission, on our Facebook page. Like, follow the page, and stay connected as we learn about how to keep fit. So we're going to go straight to the presentation from Dr. Rajan, and it's my pleasure to invite Dr. Rajan to take us with the presentation. Thank you.
Am I with you?
Yes, you are, Doc.
Yeah. Thank you all very much for having me here. As Peter shared, I'm Daniel. I work as an orthopedic consultant surgeon in United Kingdom, and it's my honor to be a part of this webinar series. It's a well thought of idea, and essentially a very important thing to think about in this time. And Peter, well done for birthing this. And first of all, I thank you. And secondly, I wish you the very best, as you, I'm sure, will do many more series as such. Well, my topic, as Peter shared with me, was how to stay fit during COVID-19 period. It's been a tough time. It's been a complete lockdown here. I'm not sure how about in the area where you live, but certainly gyms are closed and much of the outdoor activities were closed. So my takeaway 3 points that I like to convey in the next 20 minutes to you is point number one, stay active but safe, and do what suits you best. For some, it's running. For some, it's floor exercises, mat exercises. For some, it's couch exercises. For some, something else. But do what suits you best. And point number three, in this whole time of crisis and challenges and doom and gloom in most part of the world, stay fit, not just the body, but mind and soul too. I'm happy to elaborate on these things, and let me start away by saying how we'll go about for the next 15 to 18 minutes. Well, I have planned the presentation into two categories. Basically, some of us exercise regularly, and there are yet others who don't exercise regularly. This is not something catered to those who are fit and those who are not fit. This is catered to people who exercise regularly and also to people who don't exercise regularly. Now, let's take the easier bit. People who don't exercise regularly. Well, during this COVID time, there are umpteen ways you can keep yourself fit, although you're not a regular exerciser. One of the best people normally think about running or talk about running, think about weightlifting and other HIT programs, or high intensity interval training programs, to say they want to keep fit. Let me put this straight. Let me tell you, as an orthopedic surgeon and also a person who has looked into this, you don't have to do all these, permit me to say, the high funder exercises to be fit. Simple walking can keep you fit. 20 minutes of walking a day, 3 times a week, can reduce heart problems and various other hypertension, cardiovascular, all sorts of problems by 20%. This is just a ballpark figure, but it's well established. There are good articles to show that. Simple walking at your own pace, which means when you say your own pace of walking or your own pace of running, I mean a pace where you can talk to another person or you can talk to yourself. That's your comfortable pace. So simple walking for 20 minutes, 3 times a week, can keep you really fit. Well, this can vary if you have an associated problem with the hip or problem with the ankle, or if you have an associated problem with balance or neurological problems. But on the whole, this is the dictum: 20 minutes of walking 3 times a day will reduce cardiovascular and other problems by 20%. Well, so outdoor walking is possible now, especially in most countries. The lockdown is easing, so outdoor walking is possible. But if this talk was about 5-6 weeks ago, and God forbid, if we ever have to go into lockdown again, you can't do outdoor walking. So in that case, you can use a flight of stairs, or you can do 20-30 minutes of push-ups on your calf, or any other exercises that suits your lower limb and upper limb musculature and joints. So while we are there, people who don't exercise regularly, it's a good thing to start away by thinking walking. Not with weights, not with anything fancy, which is good if you can, but simple walking. Let me go to the next point. There are plenty of mat exercises, simple push-ups, lots of exercises. I don't want to spend my rest of the talk time on mat exercises or couch exercises or bed exercises. One point I'll make here: if you are stuck, say for example, I did give this point out during one of my talks earlier on in the lockdown periods where people were not allowed to go out. One of the things is, when you see movie, you can do your quadriceps drill. You can do your quads exercises. You can do your shoulder exercises, not to irritate the person seeing the movie with you, just in case you are with company. However, there are various exercises, active and passive exercises, gentle exercises, which you can start right from the tip of the toes, ankle, knee, and very gently onto the hip, and then of course your shoulder, elbow, and the wrist. So with this, I move on to the next section. If you exercise regularly, and if you think you are the person who wants to run, during COVID time, there is no shortcut from taking account the various measures laid down by your government wherever you are. I'll come to that in a bit more details. But point number two about running during COVID period, you got to be careful of the occasional running. What I mean by that is, if you're not used to running, if you haven't run for a long time, then don't start running immediately. You're more susceptible to injuries. You will harm yourself more than do any good. Take it on a gradual, progressive, phased manner. Maybe start walking, maybe a fast walk, power walk, and then go to gentle jog, easy jog, and then go on to comfortable jogging and slowly tease your body into running. Be careful of the occasional runner who is motivated once every 6 or 10 weeks and then go for a running. Point number three, I will come back to point number two, taking into account COVID-19 measures. Prevention of injuries, extrinsic and intrinsic factors. Injuries must be prevented. You can either sort them out into two paragraphs. I have, for easier understanding, I put extrinsic factors that cause injuries. One thing is the shoe. How often do you change your shoe? Is the shoe worn out? You will be amazed at the number of times I have seen tendon injuries, especially those of you medically oriented here. I know a few of you are, especially the inner tendons, the tibialis posterior tendon being put into jeopardy, mainly because of worn out inner soles and the heels going that way. So shoes is very important. And also, what is the type of apparel you wear? What is the type of dress you wear? What is the type of whatever is comfortable? Socks, be it socks, check your socks. Are there holes? These are all various ways in which extrinsic factors can cause injuries. Next thing is the surface on which you run. If you run on pavement continuously if your running style was a thumb style, some people, I say, have the thud sort of running. They thud a lot when you run, especially that group of people. If you do pavement running mainly, you'll get shin splints. You'll get ache around your heel bone, the calcaneum. So you got to change the surface as often as possible. Pavement running can be painful. Go to some bit of trail running, or if you don't have trails, you can go for some park running. Obviously, as you get used to it, you should be able to combine everything. Park running, pavement running, road running, and you got to say, I can fit in this many kilometers or miles of road running, but not more than that. So prevention of injuries, very important. And intrinsic factors, I think this is very important. A runner will know whether it's a very achieved runner or a runner in the beginning stages. When you run, you need to know what are the factors that tell me that I'm overdoing it or I need to stretch myself. It's very important. What I'm trying to say is it's good for runners to set personal best records, have your GPS on, your sat nav or Runkeeper or Strava on, and go for a particular goal. But if you don't listen to yourself, then you're more injury prone. I call this in broad terms intrinsic factors. Watch out for those hamstrings when you go up a hilly slope, when you run, especially after doing a 10K or a 5K. When you go up running, watch out, listen to the hamstrings, listen to your back. If it hurts, change the speed at which you run. Slow down, slow down. You want to run for X many decades, not just for 1 or 2 hours. You want to run for many, many years. So be careful of the intrinsic signs that come up in your body and change. Maybe there's lactic acidosis building up. Relax. It's okay. You might be planning for a 2-hour run, but it's okay. Take a break. Take 15 minutes. Take 5 minutes break. 2 minutes break will sort out a lot of tightness. Stretch, and then keep listening to your intrinsic factors. If it hurts, if there is pain, listen to the pain. Sometimes I tell this during my talks. Pain is a very good friend. Let me repeat that. Pain is a very good friend. It warns you against injuries, and it sort of is there to guide you. Look, something needs to be looked at. So, intrinsic factors. I will come to COVID-19 measures later on, but however, I'll just quickly tell there are plenty of exercises on YouTube. Those who are not into running, or those who have just don't feel like doing outdoor fitness programs, there are plenty on YouTube at all levels, at beginner level, intermediate level, high level activities. I will not go into that, but one point can I mention here: stretching is very important. Whether you do walking or whether you do weights or floor exercises, it's of paramount importance that you stretch. We call in the runner's world as limbering down. You need to really limber down, loosen up, and stretch. There are various ways to do it. You can do indoor stretching or outdoor stretching. For me, usually it is before, if I've done a long distance, say about 30K or 40K run, then probably the last 1 or 2K during my training will be literally a limbering down program. So stretch is very important. Let me go very quickly in the next 5-6 minutes I have left. Take into account COVID-19 measures. I don't want this talk for any reason to say, let's all go get fit. COVID has eased off. Yes, it has eased off in many countries, but we do not know much about the blooming virus, do we? No. We don't know the trends, the epidemiological trends that are going to follow once the lockdown is eased off. So listen to the government's regulations, listen to the government's advice, protocols, measures, whatever, wherever you work or study or university, listen to the protocol they follow. But one thing, if you're running outside, especially during COVID time, I did mention this at another talk, you got to be sure you got to do with a run. Do with a mask. Now, it's pretty uncomfortable to run with a mask. It does come in the way of your breathing. Even more uncomfortable if the mask is a paper mask, because it is messy. It won't absorb as well as a cloth mask is there. I mean, those who are into serious running, well, I've shown you a picture there. That's Snood, S-N-O-O-D. There are various types. This particular Snood, out of experience in the last 10 weeks, I've tried these. I've got 2 of them. They work quite well. They are gentle on your ears. They can be on it. Yesterday, I did a 51K for 6 hours, 7 hours, sorry. They're gentle on your ears. And the cloth over your nose has got a double layer. It's breathable. And also the breathing is so easy. It's very thin. It is pretty safe. I don't have the medical proof for it, but a snood like that with gently fits in and gives you a snug fitting for the ala of your face and the nose and the ear will do good. Then the next topic is the 2 meter or 6 feet gap, whichever part of the world you are, whether you follow metric system or imperial system, 2 meter, 6 feet gap. It's difficult, especially if you do park running or trail running. I've put a trail which I normally use in Cambridgeshire. That's a very narrow trail. Now, for those of you who like to run and get the clock ticking, you might think, well, I don't want to keep the 2 meter gap with the runner coming opposite. It's not safe. If there is no gap, you got to stop. Let me put it, because people are breathing at a much deeper inhalation, expiration rate, and you don't want to run close to them. So stop, stay aside, and then let the opposite runner go by. Most often, what I have seen in the last 9 to 10 weeks, people have developed a body language. The opposite runner reads you rightly and says, this person is not going to go to the right, or you can read the other person's body language. One point of caution though, when you stop or when you slow down to go to one side of the trail, be very careful. There could be rabbit holes, uneven ground, there could be a hole there. So you are already tired, and then when you go and run on the path, on the side of the path or the trail, you're more prone to injury. So be careful. My dictum is, when in doubt, if I don't know the trail quite well, stop, let the runner go. So 2 meter gap, 6 feet gap is important. Lastly, disinfectant all the tools, your goggle, your gloves, your snood, and don't come, if you're with the family, don't come into the family area such as kitchen or lounge, or if you're in a wherever you are, be careful of contacting others after a run outside. I normally, my practice is to take off all this. I have a blue tub, put all this there, spray it nicely with an ordinary Dettol or whatever disinfectant, wash your hands with soap and water, no substitute for that. And once that is done, you want to go for your stretch again or shower or whatever there. So there's plenty of time for questions and answers. Three takeaway points: stay active but safe. Do what suits you best. If walking suits you, walking is good. Better than running, I would say. Enjoy it. And always in this time of lockdown, prolonged lockdown, not just the body, stay fit in mind and soul too. I want to thank you so much. I just thought I'll put this there. This is a flower which I saw on the side of a trail a few days ago. And this flower has withstood all the runners going up and down. It stood firm, it stood still, and it's colorful, it's beautiful, it's bright, but all alone, taking care of itself. Take care, stay safe. Thank you.
Right, right. Take care, stay safe. And that is amazing. It's so amazing, Doc. I mean, I just can't elaborate it enough of how this short but really, really, really insightful presentation of yours is. Right, Doc. So I think we are receiving some questions from some of our listeners, and we are going to, I'm going to present them to you to just get answers to them in order. But then when it comes to staying fit, especially, I think many problems of people is the motivation to start, the motivation to start. So in your experience with many times of, I mean, doing physical activity and everything, what motivation gets you on course, and what can you tell our listeners to keep them motivated to always deciding to stay fit, even in this pandemic situation that everyone wants to stay in their house? What motivation?
It's a very nice question, Peter. Thank you for asking that. I think what motivates me is my passion to stay fit.
Okay.
If you take care of yourself, the only person to benefit the most is yourself.
Okay.
Obviously, your friends are happy that you're alive, healthy, and still fit. Your family is happy. But who is the person most benefited? It's you. You function well. Productivity is good. See, for me, to share my personal story, my first cross country was about 42 years ago.
Okay.
I've done 42 years of cross country running.
Wow.
And I was always keen on keeping myself fit. As an orthopedic surgeon, sometimes I come late at 10:30. I still, if I'm not too tired, I will still go for a jog. And also, what motivates me is it's always nice to, go out, get some fresh air, get some time to yourself. For me, especially running is my passion. I think a lot, I dream, I pray for my friends, I plan a lot of things. And sometimes when you do a 4-hour running, you've achieved a lot more than just running. So the benefits are a lot. And it's really not difficult for me to get motivated. But for those who lack motivation, the other tips I would like to share later on. Have I answered your question?
Yes, you have, and I think it's really great. But then, even in this COVID situation, there have been some various articles, especially by the American College of Sports Medicine, where they talk about exercise immunology and how exercise is able to improve the immune system. So do you think that even in this pandemic situation, that level of fitness or exercise will be able to warrant some form of, immunity to boost the immune system of people who participate in that? And you think it's motivation enough to do that?
Uh, I haven't read those articles.
Mm-hmm.
However, since you brought in a very important point, and
Mm-hmm.
rightly so, immunity, I think during this, you need to take care of your immunity all the time, but during this COVID season, even more so. I have supplemented my diet with everyday vitamin D. Now, some
Okay.
people might argue every day is too much, but if it's a regular strength, every
Mm-hmm.
day vitamin D till COVID 19 is over, it's not a bad idea. There are many articles which say vitamin D levels are important for that. And also, I think there are lots of other good foods which I planned and I'm consuming more. Lentils,
Okay.
some of the greens like edamame, beans, and uh, uh, kale. Kale is a very good green to increase your immunity as well. There are so many other food. All you have to do is search. But from my personal experience, all these greens, especially things like kale, ginger, edamame, um, does enhance immunity. For me, vitamin D as well, especially people with melanin or my color. You got to be careful of vitamin D levels. So you got to take care of that. And these are the ways in which you can keep your immunity as good as possible.
Okay, okay. And talking about food, um, even though you might not have had an expertise on maybe nutrition things, but I mean, do you think I can give an advice concerning even dieting in this particular state that we are in COVID-19? Because a lot of people are very concerned with being sedentary, increasing weight, and they are so much concerned about the fact that they get energy in, but they can't expend the energy rigorously. So that level of increasing weight is, so is there any advice you can warrant on, dieting as well?
Yeah, I would say it needs uh, discipline. But again, if you think of the benefits you have in eating healthy, then you will motivate yourself to that. Now, if you love food, I love food. I love rich, healthy chocolate with cream and fondant and all that stuff. But I know that they're high calorie food. I
Mm-hmm.
treat myself I treat myself to these rich foods occasionally in a planned manner. Say, example, if you are having say a three-course meal and you want to have a good weekend with you and your family, there's a good dinner, three-course meal. Go easy on the starter. If you want to have a starter, go for something salady, if I may use the word. Go something which is not fried, so that you know your main course will be a big steak or whatever. And then go easy on the dessert. You know what I mean? Go for a fruit salad or a coffee. But if you plan to have a big dessert, then go easy with the mains. You don't have to punish yourself by eating against your desires, but there are ways in which you can give in and take. Uh, rich food and strong food. And also I think you have to be aware, like you said, if you are not doing much exercise during this period, you're going to build up calories, and you're going to build up these calories are going to build up as fat or unnecessary healthy tissue in your body. You got to, I'm not saying fear, for the lack of words, you got to fear that, because once you build it up, then shedding that off will be very difficult. even if you're a seasoned runner or a seasoned regular exercise, you got to be careful. So I think one of the thing will be to check your BMI regularly. Anybody can have it on their phone, iPhone or whatever phone. You can check your BMI. The other thing is also to have, say, weekends, I will eat like whatever I want to eat.
Wow.
So 5 days a week, you can treat yourself in many ways. You can do. I do that, and I think I don't find it that difficult.
Okay, okay. That's great. That's great. So if you just join us, we are having a webinar session with Dr. Daniel Rajan. Dr. Daniel Rajan is a consultant orthopedic surgeon at the Spear Cambridge Hospital in the UK, and he has been talking to us about how to stay fit in this COVID-19 pandemic. And you can send in your questions, and we get to him. So there's someone listening to us called James Clark. Now, James Clark is saying that, thank you so much for your advices, Dr. Rajan. I have a question concerning pain as a signal that something has to change. Now, as a runner, I tend to see discomfort or a slight pain at times as a sign that my body is adapting. So I try to bear with it. Any advice on how to distinguish between pain that can lead to injury as opposed to pain that is a mere sign that my body is adapting?
Very nice question. I think I know a James Clark who is quite a serious runner on Runkeeper. Is this the same James Clark?
I don't know. He sent a message privately to me on our Facebook page. So I think so.
I have a James Clark who is a serious runner. So let me address this. James, thank you for that question. Pain that is gentle and not acute, which slowly builds in your body as you progressively run, is a nice pain, if at all there is a nice pain. Okay? But pain that comes about where it leads to muscle tightness or the earliest form of spasm, that is dangerous.
Okay.
That means there is lactic acidosis building up. Or pain at the ankle. You might be running on uneven surface. Once that patch of the uneven surface is over, and if that pain goes, that means it's nothing wrong with the ankle. What I call in my talk is an extrinsic factor. But if a pain is consistently bothering you, 1 kilometer, 2 kilometers, and it's causing you discomfort, then I think it's not the good type of pain. It's a pain which is actually a red flag. The body is trying to raise a red flag and tell you, halt, think, and change your style of running, your cadence or your number of steps or your distance of run, stride. You can change all these things, and then very soon you realize, oh, the pain is gone. That's a good pain. Okay. And I didn't get where you get the pain from. I can be more specific if you want to, if you want me to. But however, I think I've answered your question there.
Right, right. I think you have, and I think he might send a follow up, and I'll get it to you as and when James send the follow up. But then we have one student listening to us. I mean, Philip, who is a student, and he's asking that, especially with students, we are in a lot of, mental agony because of this lockdown, coupled with studies and other things. So you as an orthopedic surgeon, you're able to juggle it, with your work and be fit and all that. What advice are you going to give to us students? You've been a student before, and you know medical school and the problems and everything. How can we juggle between all these things?
Well, Philip, is it? You said the name?
Philip.
Yeah. Philip, thank you for the question. You may either like me or hate me for this answer. Let me answer it this way. Even Jesus Christ had only 24 hours. God didn't give Jesus Christ 26 hours and gave the rest of human beings 24 hours. We all have 24 hours. If we plan, we can fit in as much as possible into a day. Of course, there should be days when you just laze around on the lounge, which is fantastic. But our life is more productive, especially balancing between studies and work. I ran throughout my university days, MBBS days, higher surgical training days, FRCS training days, and I ran throughout my career. I still run. And I have 4 children, uh, grown up children who are not with me. But there was a stage when I had to be a dad of 4, husband, and I'm also an ordained pastor. I had to fit all this into one. It is possible provided we plan. Let me get it very in simple terms. If you have a project or a seminar to hand in by Friday, then you probably will be busy as a medical student or student wherever you are on Wednesday, Thursday, Friday. So plan for a good run on Saturday or an exercise program on Saturday. Come Saturday, you'll have 100 reasons to say, well, I'm not doing it today. I had a seminar on Friday. Let me ease it. No, go for it. It doesn't take long. And then, it's a question of planning and executing it. Are you with me? There'll be 100 reasons in my mind to say, I'm not going to run today. Either it's too cold. England is most of the time cold. Either it's raining, where we have lots of rain today. And you'll have 100 other reasons to say, today you are excused from running. But I have to know, well, I've got to keep my target. I will go for running or exercise or whatever. So it is a question of planning. If you really take a paper and pen and put down the number of times you're free in a week, you'll be surprised. Even the busiest student will have lots of slots where he or she can fit in some exercise program somewhere. All right.
That's great. It's a very perfect answer, Doc, and especially for many other people who are using different engagements to just get an excuse that, oh, I'm busy, I don't have time, and I think it's a great answer, and not only Philip, but I think many people who are listening to us will take a cue from that as well. Right, right. So there's another question of, especially when you talk about masking up and all those things for exercise and all that. One of our listeners want to find out how is this going to help, especially people who are compromised in their respiratory system. For example, asthmatics, and they, when they run, they are even gasping for some air and all that. What masking up and how people with compromised respiratory system, how they going to cope with that, and what is your advice for that?
Sure. If the question is the mask compromising their respiratory system while
No,
doing outdoor activities?
they are already having a compromised respiratory system, and they are advised that they can exercise for some small exercise and all that. But when you max up, it will kind of limit the level of inhalation that you have. And so, is it still a good advice for them to do so, especially if they want to still exercise in this?
I think it's important to use the mask, however uncomfortable you are.
Okay.
Because if the guidelines is to use a mask, use a mask. The one I've shown on the picture, I've advised this at other running forums as well. It's a cloth one, which is pretty much elastic over here, comfortable. Enough air goes in and goes out, but there is a thin filter there. But if you don't have this, use an ordinary mask. And for those people who've got a compromised respiratory system, you got to be careful that you don't go to the level where you're, gasping for air, or you're not feeling happy with your breathing rate. And obviously, if your oxygen intake is not good, you will feel it in your muscles. You will have lactic acidosis buildup, muscles go into a little bit of tightness, you're not comfortable, you're not enjoying it, and that's not safe. So use the mask. And if your respiratory system compromised, then taper it to that level. You know your maximum, where you enjoy that level of function, but do it regularly. It needn't be a big chunk of exercise program, just whatever your body can cope with. And also alter the speed at which you do it. your inspiratory volume may not be that high as a normal anatomy, but if it's compromised, the way you expire and inspire may be difficult. So you do it at your particular speed, whether it be floor exercises or couch exercises or walking or jogging. Do it at a speed where there's enough air to prevent enough air in how much you breathe to prevent lactic acidosis or muscle spasm, anything that. Don't jeopardize yourself. Be
All
careful.
right. All right, Doc, thank you very much. And before the next question, James Clark just confirmed that he's the James you're talking about, and he's impressed with the response you gave to his question. And
Oh, thank you, James. Lovely to meet you. I will see you on the Runkeeper. Bless you.
That's awesome. That's awesome. Right. So there's a listener, Rohit. Rohit wants to find out. He I said about that experienced runners getting prone to hydrocele. So how is running, or how do you prevent, especially since you have been into running for more than 40 years, how do you use to prevent hydrocele?
Okay, hydrocele. Let me put it this way: if the hydrocele is quite a sheer want of, I'm not a general surgeon. I said bye to general surgery nearly 25 years ago, 30 years ago. If the hydrocele is not moderate amount, in those days we used to say small hydrocele, moderate, large hydrocele. If it's not moderate, I suppose you still can go running as long as there is no pain. If there is pain, then obviously the weight is too much there. But let me put it this way: people who have had hydrocele excised and healed well, this is a webinar, so some people may agree with me, some people may not. Those people who've got good, healed well, still should prevent it. One of the ways I have told people is to, if I may put it blatantly, there's no other words, pull the scrotum upwards. And there are special undergarments which have a pouch, which is again snug fitting, elastic, which is gentle onto the scrotum and the genital organs, and it will be linked onto the waist. It's very simple. It's a special undergarment with a pouch, enough for the hydrocele to be, not hydrocele, the healed hydrocele to be pushed up. But I've never given advice for people running with hydrocele, but I think I have seen patients in my general surgery days, lots of them have minimal hydrocele, is more of a clinical red herring, if I may say it that way. They lead a normal life. But if the hydrocele does cause pain while running, be careful not to let it not to let the external genitalia sit between the thighs, if I may put it that way. Pull it up. There are undergarments for that. I hope I have answered the question. I'll be happy to do it on a personal note, Peter, if you want to give my details to Rohit. I'll be fine to do that.
Right. So yes, Rohit. So if you want to get more clarification on that, I think you can contact me. You can contact our Facebook page, and I will connect you to Dr. Rajan. So if you just join us, we are still doing the question and answer session on the presentation. Dr. Daniel Rajan just took us through about how to stay fit in this COVID-19 period. Now, Dr. Rajan is a consultant trauma and orthopedic surgeon, and he's such a great enthusiast when it comes to fitness. And he has elaborated on how we can stay fit even in this session. So you can send in your questions via our comment session, our comment page on our Facebook wall, Prevent First Commission, and we will let Dr. Daniel Rajan answer it for you. Now, Doc, so talking about the fact that many societies, many countries are still enforcing the lockdown session, even though some are easing it and all that. But still, people are psychologically tuned into the fact that they don't want to go out in all that. I think you may want to elaborate more. Some of our listeners want to find out some of the very beneficial exercises they can do right in their room. They wake up from their bed, and some of the beneficial exercise they can do right in their room so that they can still remain fit instead of maybe going out for walking or for running? What kind of exercise do you think they can do that?
Sure. I think lying in bed, I think when I wake up in the morning, especially if I've done a long run the previous day, I spend about a minute, minute and a half or two to stretch my Achilles tendon. Very simple. If I can show it on my hand, if you think this is the back of the calf, bend your knee towards yourself so that the gastrosoleus is relaxed, and then you can keep pulling your ankle upwards. That'll stretch your gastrosoleus, the Achilles tendon. And then, if this is the right foot of mine, use your left foot to gently drag the right foot upwards. That will also stretch the plantar fascia. Simple exercise. So, bend the right knee, pull the right ankle towards you, use the left foot to pull the forefoot towards you. It'll stretch the gastrosoleus, Achilles tendon, and the plantar fascia. Simple technique. While you straighten your knee, keep it still like that. You will feel the gastrosoleus stretch nicely. Keep the ankle pulled up and straighten your knee. Do it on both sides 2-3 times. And also, other thing, I have advised this to my patients as well, those who have especially stiffness of the ankle. Draw a large circle with the tip of your big toe. Straighten the tip toe and draw a big circle as large as you can. You just widen the radius of the ankle, of the circle. And that way you do dorsiflexion, plantar flexion, eversion, inversion, rotation, the whole works. So ankle, knee, and hips, you can always abduct and you can always pull it apart, pull it towards the side and push it back gently. Shoulder, there are many there. It's not easy to show, but simple exercise for the shoulder while in bed is to keep both your fingertips here, stretch the elbow outwards. Obviously you are in bed, so you can't do it this way. You should keep it to the ceiling and draw a circle with the tip of your elbow, the olecranon. Draw a circle as big as possible. Your rotators, your shoulder girdle, everything is put into use. There are plenty available on YouTube, but these are some simple things I would advise.
All right, Doc, thank you very much. So someone is just asking that, as an orthopedic surgeon, what are some of the exercise-induced injuries that are common in your hospital, and how to avoid most of them? Because I think people get to focus on the negative side of exercising, of getting injuries and all that. For example, you talk about extrinsic and intrinsic injuries and all that. What are some of the common presentation of injuries in your practice, and how to avoid most of them?
Good. I'm glad this person asked that question. I can't stress enough the phrase I used there. I've used it in many talks and also to many patients. It's the occasional runner that gets hurt. In the UK, we have the London Marathon. 2-3 weeks after that, lots of people come with injuries because they've seen a marathon, they're excited, they go for running. It's the emotionally charged, the focused on running. These type of runners who occasionally run are more prone to injuries. But if you run regularly, building up slowly in a gentle, progressive manner, you'll run for years. You'll run for decades. The injuries that I've seen most often with these unhealthy spurts of running is with the Achilles tendon. That tendon is not a very grateful tendon. It's one of the biggest tendons in the body. It doesn't have a good blood supply. So the Achilles tendon will remind you forever, even if it's just a partial tear. And often this is because of unaccustomed exercise. You're not used to it. Put on your boots. Whoa, I want to take care of my BMI. Here I go for a 10K and come back, or 5K and come back. No, if you have not done a 5K, do a 1K, 2K, 3K. Build it up slowly. So Achilles tendon. And then any injury is possible. And you'll be surprised. All it takes is a very gentle rotation of the ankle, maybe even 15-20 degrees, because there is an uneven surface in the trail and your ankle turns awkwardly. And I've seen fractures many a times. The ankle just breaks. That's why you got to be cautious. The more tired you are, the more cautious. And that's why when you're tired, be careful how fast you're running, what is the level. I made this point, choose the surface on which you run. If you got plantar fasciitis, that is a pain at the bottom of the heel, which comes about in the morning as you wake up, that's plantar fasciitis in lay terms. If you got it, then choose just trail running or mud running or park run. Don't go on pavement or on road. And there are special shoes which is advertised as for trail running. So there are plenty there available for you to suit yourself and do what is safe. I can go into a list of other injuries, but I just mentioned a few at the ankle and foot.
All right, thank you very much, Doc, for that. Thank you very much. And I think we have some elderly people who want to also get clarification, especially in this pandemic situation where already researches are mounting that the aged 65 years and above, children, immunocompromised people, and all that, they are at a greater risk of mortality when they get this condition. So the elderly people, what is your advice for them? Because they are afraid to go out to exercise and all that. So 65 years and above and all that, what do they do to stay fit? Because some of them, they have not gone into running or marathon for more than 40 years as you have done. So some of them, they just want to pick up because of this situation. What advice do you want to have for them, Doc?
Sure. I think important thing would be if you're in that particular cohort of people who can't go out for various reasons, especially you mentioned people in the higher age group. One of the things would be if you have a flight of steps, use them. Use a flight of steps, and you can put most of your muscles into use by going up a flight of steps and coming down. Let me tell you, going up a flight of steps, depending on your fitness, you can use a rail or not use a rail. Obviously, if you have cardiovascular problems and if you have other issues, you want to use a rail. You want to be safe, and you want to use a rail. Go up a flight of steps just on your forefoot, just the forefoot. You will find that the entire calf muscles are put into beautiful use. And while you go up on your forefoot, you're also putting into use all the small muscles, the extrinsic muscles. And all the foot joints are loaded and they're being put into use. There are 23 bones in the foot. And just by going up on your forefoot, just part of the forefoot and the heel, if you go up on your forefoot using a rail gently up the steps, that's a good exercise. And also, you're also using your quadriceps as well. So quadriceps is done, knee muscles are done, not the hamstrings, knee muscles are done, and also your ankle is done. And then the next one would be when you come down. When you come down, come up on the flat of your foot. Obviously, if you have balance problem, you got to come by the side. Otherwise, come on the flat of the foot and you'll again use your quadriceps and this time the hamstrings as well. And if you make sure, well, I want to spend the next 10 minutes using this flight of steps, keep your posture erect. While you go up a flight of steps, try this out, very simple, on your forefoot. And if you keep your posture erect, you're putting your back muscles, erector spinae also into use, at least to keep the tone up there. You can do that, or you can do an entirely different group of exercises, just static exercises. Stand there. If you're on the higher age group and you think balance is a problem, be careful not to lose your balance, but you can hold on to a desk which is at your hip level or a chair which is at your hip level. And you can put all the muscles of hip, knee and ankle to action, and also your back muscles also to action. For shoulder, I have advised this before. Simple thing. Not many people have slings and fancy ribbons, which is easily available on YouTube, all these fancy ribbons. But you can just use a towel. You can have it at the back there and then act in this manner. So while one hand goes up, another hand comes up. and simple exercises like that. Okay, I don't want to go through all the list, but I'm happy to answer
Right,
if it.
right, right. So I think it would be good. It would be good for such practice, especially the uphill steps. I think most houses are having such, and it will be a very effective way of even improving cardiovascular fitness as well as you go upstairs. And I mean, it's a very good one. Thank you for that advice, Doc, on that. However, I think I don't know if it should be a follow-up to that aged people, but there's a question about people who are infected with the SARS-CoV-2 and they are in isolation, however, currently asymptomatic. Um, what is your advice for such people? Because the idea of the question is that is the exercise not going to exacerbate their current condition for them to start um, being weak or start having or incite some of these symptoms in COVID-19? Do you think that's a good idea for people who are isolated? I mean, they have been infected and isolated and asymptomatic, but do you think the exercise will be good to couple with their medication, or you think they should at least halt it for the time being?
Uh, People who are infected but asymptomatic
Yes.
can still do all the exercises as long as they don't have any other medical or orthopedic problems of balance and things like that. But people who have been in ITU and then got cured and are asymptomatic now, for that group, I don't have any experience at all. As an orthopedic surgeon, I have no experience in that. So I probably shouldn't comment on that. But I can reiterate that people who are asymptomatic but has got a COVID positive test, but they're fit and well, they still can do exercises in the indoors, as I mentioned a short while ago. But the other group, I'm not able to comment. I don't have any experience on that.
Right. So I think this question, I think you have touched it, but I don't know if you still want to address it. There's a question from Belhaj Betiti. Belhaj Betiti is one of our listeners on Facebook, talking about people who want to start into running. I mean, perhaps experience running like what you have been doing, Doc, and but they are about 40. So about 40 people, what guidelines can you give to such people for them to be in a very good progress of being very good runners? Behaj Betiti want to find out.
Bihaj, thank you for that question. I think age is no limit to start running. Obviously, the higher the age, obviously you got to be giving more time for your body to get used to running. 40 is by far quite a very young age for by any standards for running. Let me qualify that further. I probably think during third decade and fourth decade, that's my experience. My third decade and fourth decade, I went into a transition of deciding, however difficult it was, I shall stop chasing records. I shall stop chasing the clock. I decided around about my 40, the fourth decade. I still remember it was a Leeds Marathon in 1998. May the 16th. I enjoyed that marathon. Then I thought, oh gosh, I am 40. I want to run for decades. I thought to myself, I will stop chasing PBs. No harm in having a goal, but chasing PBs, personal best, chasing targets which are unreasonable, then you get hurt. So if you want to start running, have a goal. What do you want to do? I want to enjoy running. Okay, for how long? As many decades as possible. How do I start? Let me start off. If you have run before, that's fine. If not, start off with walking, power walking, which is good, gentle jogging, then comfortable jogging. Once you reach comfortable jogging, that means you can run and talk to yourself at the same time or with a colleague at the same time. You can easily do a 5K. And once you do 5, I'm thinking that you're starting running as a beginner. So I think I'm on the right track. Once you touch a 5K, then you start enjoying the heart rate, the sweat, and then you want a 10K as soon as possible. Then there are plenty of ways to get the 10K very gently without hurting yourself. And once you hit the 10K mark, you've enjoyed the sweat, the discipline, the whole experience of running out, then believe me, you're going to run and run and run.
Awesome, awesome. So, Behel, I hope you are satisfied with the answer. You can come up with a follow-up if you are not. Right. So there's this interesting question, Doc. I don't know if you want to address it. One of our listeners want to find out how you measure fitness. How will you know that after doing all these recommendations, you are fit? I mean, how do you want to measure fitness? I mean, because you find that people who generally decide to walk in an unstructured kind of walking, they just stand up and just go anywhere to just maybe do groceries or do things. So they feel that so far as they have been walking to do groceries or do other things, they are fit. How do you want to measure fitness for someone to see that if you are doing this, then you are being fit, but if you are doing this, it doesn't qualify to be fit?
Okay, I will divide that answer into 2 sections. Measuring fitness in sort of some medical way, measuring fitness without having to do medical procedures or whatever. If you want to say medical parameters for fitness would be your heart rate. Your resting heart rate should be well below 72, 76, 70, around that. Mine is 58, if I may share it on the webinar. Mine is 58, and it's been like that since 1988, 87, 58. And BP should be normal. A normal BP is 120, and diastolic anything by below 90. The more exercise you do, the more fitness you do, the BP is more. Mine is 100 by 60. Okay. So that is not to say that everybody should be 100 by 60. You will know that if you can do occasionally check your BP, check your resting heart rate, and most of all, as I said right at the beginning, check your BMI. It's easily available in this day and age. The BMI will not lie. I have mentioned this a couple of times. The weighing machine and the BMI will never lie. They always speak the truth. So even if you feel fit, if these are not pointing towards a good, a parameter, then you have to do something. The other thing is, if you're fit, you feel well. There is a feel good factor in you. You sleep well. You generally have a healthy mind. You are fit. You can cope with work. You're not irritated at work. People at work like you. You like them. Obviously, or whatever differences are there, may be there. But generally, fitness, to me, I think I introduced that in one of the slides. Fitness is more than running, or fitness is more than muscles and tendons and pumping a lot of exercises. Fitness is the body, mind, and soul. Every unhealthy soul, however fit your body is, you're a very difficult person to cope with. Healthy body, unhealthy mind is also not good. So it is a holistic view of fitness. I don't want to get too philosophical here. I'm happy to answer questions later, but you have to measure fitness deep in your heart. You will know that you're fit, you're a good person to be around with, you're healthy. Of course, you get irritated, but generally there's health around you and in you. And of course, as I said, BP, resting heart rate, BMI, weight, all that thing also helps. Okay.
That's great. That's great. And it's rather really important that you brought that in, Doc, about the fact that your fitness is so much measured with, your body, your mind, and your soul. So that it will defeat the ideas of people when they say that, oh, only when you are physically fit, that is where, I mean, everything is working out as far as your system is concerned. Last week, for instance, in our webinar, when we had Dr. Kimberly, when she talked about stress and how stress can give someone, I mean, some cardiovascular disease risk. I think she mentioned ideas about that you can be physically fit whatsoever, but the energy that stress can drain you is very enormous. And she was trying to analyze it and subject it to, I mean, advise that people should be very attentive, especially in this COVID situation, about things that prone them to stress. Because
Sure.
there are a lot of things from the media, from friends, from different places, from government policies that will cause people to have problems in their mind. And the World Health Organization rightly said that, I mean, disease or sickness is not just merely the absence of, physical infirmity or physical, I'm just paraphrasing, physical ailment. But when you have the harmony between your physical, your social, your,
Yes.
yes. So I think it's rightly important that you brought that in. Right. So it's really great. So I think listeners, if you are just following, you'll get to know that we are in a pandemic situation and things are getting, I mean, overwhelming every day and then. And I think it's important to decide to take or make the necessary decision to be healthy, even in this situation that we are in. So that is why Prevent First Commission just is putting down these things for you to know some of the things that you'll be prone to. Last week, we talked about that stress is something that can cause you, I mean, to be sick, even though you're not being infected with the virus. You realize that the virus might not be a problem for you, but the situation surrounding the virus might be a problem for you. And today we are privileged to have Dr. Rajan, who is talking about the fact that, I mean, you can utilize different things to keep you fit. And it's rather important that you take care of your health. And in this situation, the virus, you might not be infected, but you still live healthy and very fit, even in this situation that we find ourselves in. Right. So if you just join us, you can send in your questions on our Facebook page via the comment section, and Dr. Rajan is excited to answer them. We have some few minutes to spend here, so you might want to rush in that to really help analyze that. Doc, so children, this structure that you just set up for us about different things that can be done, I believe that children might not have gotten to the level where they will be experienced runners, or they are most of them are very novice when it comes to things like this that will keep them. So what advice would you give to parents to help engage children in things, activities that will keep them very fit, so that, I mean, they are part of that category of people who are prone to high mortality rates when they get this COVID situation. So what advice would you give to especially parents to get their children being fit even in this situation?
Sure. I think you rightly said, children are, they are nervous in this. They will find ways to keep themselves active. In fact, having spoken to quite a few parents who have little children, they're actually tired running after the children. They are active. Children are quite active by nature. But I think in terms of fitness, kids need to go out. But in our country, we can go once a day out. The lockdown is easing. But I've seen parents take the children out for a long walk, or whatever walk they can cope with. And that is one of the best way. I think you're not allowed team sports. You're not allowed any other indoor activities elsewhere, like in a theme park or entertainment park. So what I've seen around where I am living is that parents do take their children for long walks and make sure that they keep themselves fit, healthy. Children, it's not a very difficult thing to keep themselves fit. They often are quite nervous, as they say, as you say.
Right. Um, well, I don't know. I don't know if this question will be relevant to the discussion, but let me just say if you want to offer your advice on that. There's a listener. He manages some professional players, and I think one of them, or I think some of them, have been having minor ACL tear and all that. And in this COVID situation, I think it has been characterized in the setting that they are in as being non-essential ACL tear. So, what advice can you do outside surgery that you think the person can recover from this tear?
Yeah, ACL tears depends whether it's a partial tear or full thickness tear. Obviously, this person is dealing with professional players.
Yes.
So ACL is very important to any professional sportsman. Um, for ACL tears, I think even if it's complete tear, I've stopped doing knee because I mainly concentrate with the ankle. But however, we follow a dictum: ACL tears, even if it be full thickness, we we do advise them a full rehabilitation program, non-surgical rehabilitation program, via building up the hamstrings. There are various types of hamstring exercises easily available on YouTube and easily reproducible. However, if it's a professional sportsman, and if it's a complete ACL tear, as soon as possible, get the orthopedic surgeon's advice, make sure the diagnosis is made, because sometimes ACL tears can be associated with a meniscal tear as well, which is an entirely different kettle of fish. So you got to get a three-dimensional imaging there. And then once that is done, a lot of them, that's been my experience when I used to do knee, a lot of them recuperate quite well, and a lot of them go back to good level of sports without even surgical intervention. But if there's surgical intervention, it can be done, and most surgeons have good results with ACL repair, but very rarely it's needed. And I think the hamstring drill and quadriceps drill, there are so many on YouTube, so many on YouTube. And some of them are presented by very well established physiotherapists as well. So there are quite a few. You can go on that and make use of it.
Okay. Thank you very much for that advice, Doc. Rita is listening to us, and she's saying that she has been very sedentary for some time, but because of boredom in this pandemic situation, she has started doing some activities on her own. However, um, a day after such activities, she has been having severe cramps, severe pains in the thighs and all that. She wants to get your advice that should she continue with the exercise, or she should rest for a week or two for the cramps to subside or for the pain to subside before she continues, or do you think that if she continues, she will adapt to it and nothing will happen to it?
Thank you for that question, Greta. Um, Cramps in a person who has been sedentary for a long time is quite common. Either the cramps are because you're not warming up properly, or number two, you might be stretching yourself too much. You might be demanding from your body a lot more than you can, considering the fact that you have been sedentary for a long time. I would say one of the activities, I'm not sure what activity you're doing now, one of the activities that generally promote a bit of, pardon me if I use the term, warming up or steaming up the system is walking. I cannot emphasize this. It is safe, and you're doing at a very steady speed. And if you think, oh, walking is too easy, then increase your walking speed. If that is too easy, do power walk. And then by then, your system is fit enough for the next level of activity. But however, beware of this going back to a fitness program once you've had a prolonged period of sedentary life. You might hurt yourself. So, proper stretches, even though stretching is a very boring thing, it's quite a boring thing for me, but I do stretches. And then go back to power walking, reach power walking, and then you do some strenuous fitness program, and probably the cramps will subside. And other thing is, make sure that you're not depleted of salt, because if you're doing sudden strenuous fitness program after this prolonged period of sedentary life, then probably you're not replacing your salt, so you're sweating too much. I don't know, you just have to make sure. And when you replace salt, it's just a tiny pinch, you don't have to add much, just a tiny pinch, half a pinch will be plenty, and more. So just think of going back to fitness program in a very gradual, I've repeated this many times, gradual, progressive way without hurting yourself. Yeah.
Awesome, awesome. Thank you very much. So Rita, I hope it's answering your question, is answered. And if you have any follow-up, you can get it back. Doc, we have two more questions, and you give your final submission on this topic. Francis Hager want to find out, will you recommend, supplementation with some nutrients, some nutrient supplements in physical activity? And if you will, what some of them that you can recommend in that?
I think, Francis, I mentioned the earlier part of the talk, vitamin D, especially in COVID, would be good. And I generally think that multivitamins are good. The error most people make it is they overdo it. You don't have to take a multivitamin every day. Most multivitamin preparations come in sufficient quantities. Read the label and see what percentage of daily requirement of each vitamin is there. If it's 100% or 80% of the daily requirement, don't take that multivitamin every day for the rest of the weeks or months or whatever. Some of the vitamins, especially vitamin A, vitamin D, vitamin E, vitamin K, these are fat soluble vitamins. They stay in your system for X number of months and days, and that's not good. But some of the water soluble vitamins are fine. So read the labels, see the strength of the vitamins present. And I have nothing against vitamins, but what I've seen normally is that people tend to overdo it. So be careful of that.
Okay. Right. That's amazing. The final question, Doc, then you bring your final submission. This is more of an advice to policymakers and all that. So I think the challenge we have had with COVID is that in many countries, policy making as far as physical activity is concerned is very low. I think most people, or the advocacy that is going on, is about wearing masks, washing of hands, and many of these protective structures that are being. What advice will you give to policymakers to inculcate the advice of physical activity and increasing the publicity of the need to sound physical activity into these measures that we are putting in our policies in our various nations, though?
Peter, I couldn't thank you enough for asking this very important questions. I entirely agree with you that our policy has been how to cope with COVID. The importance of exercise, the importance of keeping oneself fit has not been stressed very much, at least in some countries. See, just imagine, I'll take a few minutes to explain this. A person with osteoarthritis with no activities can become stiff and stiffer. And you might have a COVID-free person who is much worse off with stiff joints after 14 weeks of being just indoors. Or a person with hypertension and on the larger build and various other problems with large build, might not do any exercises and may end up with various other problems, but COVID free, which is good. We all want to be COVID free. We want to live longer. But I don't think the uh, message came across. Even if you're COVID negative, beware. You got to keep on the move. You got to do it as safe as possible. Do it whichever way fits you, be it step climbing indoors or just a walk outside or running or whatever you do. Do it in a way that you do keep fit. Fitness is of paramount importance here. Thank you for asking that. I would say, God forbid that we have another wave of lockdown and all that. We don't want that. We had that enough and more. But if similar situation arises, then the policymakers have to drive home the point that keep fit, keep fit, keep fit.
That's great. That's great. And I believe that a lot of policymakers are listening to us. And I think it's an important thing to emphasize that, as you rightly said, Doc, that some people, a lot of people, of course, are not going to be infected with COVID, but the post-COVID situation, especially with non-communicable disease, might be alarming because many people are very sedentary and all what they know is that they should stay home, stay home, stay home. So I think it's a very good advice from you, Doc, and I believe that policymakers will listen to that and inculcate that as part of measures to curtail future pandemics and all that. Right, Doc, so we are excited that we had you. Viewers, Doc is going to give his final words. We had Dr. Daniel Rajan, who is a consultant trauma and orthopedic surgeon, joining us for today's webinar. He's going to give his final remarks, then we will draw the curtains down. Doc, let's have your final words.
Sure. I have brought forward a slide number 3, which I showed you right at the beginning. The takeaway points are stay active but safe. Sadly, Facebook, social media advertised heavily on stay safe, stay safe, stay safe. I wish the advertisement was stay active but safe. Point number 2, how do you stay active? Do what suits you best. Lots of people say that I can't run. How do I stay fit? Walking is fine. Whatever suits you, do it in the way you can, however much you can. And then again, staying fitness, we did touch upon this. It's just not muscles and bones and the heart and the brain. It's just not the body. Staying fitness is also in the mind and also in the soul. Thank you for having me, Peter. It's been a pleasure. It was my honor to be with you all. I am really blessed to be with you all. Take care.
Thank you. Thank you. Thank you very much. And it was an honor as well to have had you. In fact, it's just a blessing to always listen to you. And I think on different occasions I've listened to you, I'm so motivated to do the right thing. So it's a pleasure to have had you. And thank you that you could give us some time to talk to us. I believe our listeners and our viewers will just get a lot of cues from this presentation, and people are going to inculcate it into their structures of the day, that not just staying safe, but stay active, but safe. And I believe that that's the way forward that a lot of people are supposed to go. So it's a pleasure to have had you, Doc. And we hope that we will have you again some other time and to talk on other topics as well. Right. Thank you as well. Yeah. So if you join us today, we thank you for joining us. This is part of the Preventive Health webinar series organized by Prevent First Commission, partnering with the European Medical Student Association in Ukraine and also Radio Power UA. So it's a pleasure that you could join us. There are other sessions coming on, so like and follow our Facebook page, Prevent First Commission, subscribe to our YouTube channel, Prevent First Commission, so that you can stay active and get to know the kind of works that are being going on. There are other great works going on our social media pages. So go on, like and subscribe, and you can get updated as and when we bring information to you. So thank you for joining us. Thank you, Radio Power UA, and thank you, European Medical Student Association Ukraine. It's a pleasure until we meet again next week with another exciting segment with Dr. Bob. Dr. Bob is a global health professor in the US. Stay tuned. We will just give more information about that event and it will be a pleasure to have you with us as well. Thank you and goodbye. Have a good night.
Bye.
All right, Doc.
Bye. Bye, Peter. It was nice. Thank you.
Right. Thank you. So
I'll leave the group now. We will catch up later.
All right, Doc. Thank you.
Bye.
Bye.
Bye-bye. God bless.